So what can you do now? It's not FDA approved, and that's something that's important to keep in mind. And it's a long road to get a medication FDA approved. You have to have different types of studies. You have to study the safety of the medication. Then you also have to do randomized clinical trials in larger numbers than what we've seen so far today. You can still ask your physician to prescribe it, and that's what's known as prescribing something off-label. Off-label means it's not approved for that indication. Ozempic is approved for certain indications, diabetes, for example, and to prescribe it in order to overcome an addictive behavior would be considered off-label because it's not an FDA-approved indication. That said, off-label prescribing is a very common practice in the practice of medicine. So if you feel comfortable with your understanding and with a discussion with your medical provider about the risks and benefits and what is known about Ozempic for your condition, then you can ask them to prescribe it off-label to you. One of the other benefits of FDA approval, however, is that it impacts the cost of the medication. So it could be very costly for individuals taking it for an indication for which it's not approved, and that's just a consideration to keep in mind. Second, we just have to be very aware that research is in very early stages. With support for accelerated research that's currently in place, there are a number of clinical trials that are currently ongoing that are funded by the National Institutes of Health to try and fast track our knowledge base about the effectiveness of these medications for substance use and addiction.